we're going to start with a great presenter from Michigan State University, Jim Pivarnik, who's going to talk to us about a research area that's incredibly difficult to do, but really important. So please welcome Dr. Pivarnik.
Okay. Howdy. As Tim said, I'm from Michigan State University, and if you know anything about us, our mascot is the Spartan. So last time he was in the lab, I taught him about the Aggies, and I think you can see he's gigging them there. So that's the best I could do. He's still wearing green. So I'm going to kind of take you on a whirlwind tour of the 25 to 26 years that I've spent in this area, and hopefully we come up with something at the end, some decisions. 100 years ago, a gentleman named Slemmons wrote a book about Handbook for Prospective Mothers. Part of it was exercise. He said the amount of exercise cannot be stated precisely. Walking is the best kind, and all kinds of violent exertion should be avoided. Tim, if we're running behind, I can end now. That's it. We haven't changed much in 100 years. However, Slemmons also said that the use of a sewing machine should be emphatically forbidden. So remember that when you're prescribing physical activity for pregnant women. So obviously the issue is, are we doing any harm? And this was the concern years ago, to the maternal fetal unit. Early studies, you can imagine, mostly on animal models. We still do animal work today, but the early studies were done on animals. For humans, it was just basic cardiorespiratory, thermoregulatory type responses, more non-invasive type things. Very limited fetal responses, fetal heart rate. Occasionally you could get some other fetal movement types of activity. And birth outcomes. Obviously, birth weight is a conglomerate of what's going on during the gestational period and gestational length and other adverse events that happen. These are the things that have been measured historically. Now, the first exercise guidelines that really had a lot of credibility in this country were from the American College of Obstetricians and Gynecologists in 1985. And they were conservative based on the limited data we had at the time. They were at the lower end. Earlier we talked about ACSM recommendations. They were at the lower end of the ACSM recommendations that were in vogue at that period of time. And the infamous heart rate should not get over 140 beats a minute, which is the bane of my existence, came out with this particular set of guidelines. There were some absolute contraindications. If a woman had multiple gestation or multiple births here, she had a diagnosed multiple gestation, she shouldn't exercise. I've given the talk before. And occasionally there's a woman in the back of the room that goes, because she did that when she was pregnant. I've never seen any information. There's the fear of premature labor, but it hasn't been documented. There also were some relative contraindications, including history of extremely sedentary lifestyle. If I gave this talk 25 years ago, I probably would not have encouraged women who had not been active previously to become active. That's certainly different now. But even then, even in 1985, this little disclaimer in the front of the 4-page article by the ACOG said, a physically fit pregnant patient may tolerate a more strenuous program. So even back then, we were realizing that one size does not fit all. Now, from 85 to 94, a lot of studies have been done. This is sort of the golden age of some of the laboratory studies. That's me in the upper right-hand corner with one of my first research subjects when I was in Houston. I was in Houston for 10 years, so I'm a naturalized Texan, and she's probably about 25 years old now. So we found out a lot of information there, and pretty much all of it was good, that we're not doing any harm. The guidelines changed in 1994 so that at least 3 days a week were preferable, so they're a little bit more upbeat. We got rid of the word heart rate. If you search for heart rate in the guidelines, you wouldn't find it, but go by maternal symptoms. So that was very exciting for those of us in the field. The most recent ones for ACOG anyway were 2002, which, if you remember the previous talks, they pretty much went along with what the CDC and the American College of Sports Medicine were saying, and that is about 30 minutes moderate activity most of the days of the week. Most of the days in CDC jargon meant 5 days of the week. Now, very most recently, Ed touched on the physical activity guidelines for Americans. And there was a pregnancy part of that, and lo and behold, it shouldn't be surprising to you that for the untrained woman who is reasonably sedentary, the 150 minutes a week of walking is fine. However, we did talk about the more athletic woman, and that if she was very athletic beforehand and she was doing fine, she could continue a lot of this activity. A number of benefits that we found for physical activity during pregnancy. Here are just some of them right here. And this is real exciting. It took a while for these studies. You see a lot of these studies are fairly recently, certainly within the last decade. Before that, in the 80s and 90s, we just didn't have this evidence. So we couldn't be quite as aggressive with our recommendations. But these are just a few of the biggies. About a half, just a little bit more, if you look at the behavioral risk factor survey, it's that survey that the CDC, it's a telephone survey that we have to every state. About half of the women who were pregnant said, I'm doing at least something. But the something was only a little bit, and only about 19 to 20% of women did the 150 minutes. So we've got a lot of work to do. So it's like anything else. Now we know it's good. How do we get women to do it? Well, which activities are the best? There's a lot of them. Is it yoga? Is it Pilates? And when women ask me that who are pregnant, I give them the same answer I'd give somebody that wasn't pregnant. Do the one that you like and the one that you're going to do, with a few caveats that I'll get into. But it really doesn't matter too much. Weight training. This was sort of a no-no for a while. And one of the reasons is we didn't have any research on it. I tell students, you want to do pregnancy research that hasn't been done very much? Do resistance training. Every big city's got a big health club with a 5'0" woman that's had 3 kids and she weighs about 102, and she's doing a resistance training exercise program. If we could evaluate all of those programs and look at outcomes, that would be a great study. Remember, if you do that, to give me credit for it. But we don't have a lot of information on it. There's very few. There's no evidence that it's harmful, and no surprise to you that they're in the resistance training business. This is pretty much the recommendations that are given. And obviously the fear earlier was the Valsalva of holding your breath, impeding blood flow to the uterus, the woman possibly passing out, or some harm to the fetus. But there's just no evidence with this. I have a student who published a paper recently that's in Journal of Physical Activity and Health that's coming out in papers soon. We looked at women who were went to 24-hour fitness kinds of places, and she said the average woman just on her own was doing this, which shouldn't be a huge surprise to you. And it was exciting. We found a decreased prevalence of hypertension and also diabetes that came upon the woman during pregnancy. So that's really exciting. And we didn't see any increase in adverse outcomes. So that's good stuff for women who do want to resistance train. But how much is okay? Right, we were talking earlier, what are the limits? What is the right amount of exercise during pregnancy? Looks like this woman was doing pretty well to keep up with her weight training even when she was pregnant. Well, little evidence. Here's I know you can't see this very well. This was in the Chronicle of Higher Education about 7 years ago, where a woman on a basketball team, NCAA basketball team, she hid her pregnancy for 8 months. And I follow our women's team quite a bit, and I know the trainers and the coaches. And I said, is this possible? I mean, how could they hide that from you? And the athletic trainer said, it's difficult but possible. And obviously it finally got to this woman's performance. Yeah, duh, imagine. And she sort of broke down, but her doctor said all things considered, she did fine. Now, is that a recommendation to play NCAA Division I basketball? Probably not. But it says that it's a pretty good situation with a lot of protection for the fetus. This was an interesting one. I got some questions about this in the 2012 Olympics. A woman from Malaysia. And the biggest issue with her, she was pretty far along, was actually the plane flight, because you're not supposed to be flying after the second trimester, and she was beyond that, but her physician said fine. And when they interviewed her, she said the main problem was, obviously, if you know, you're in Texas, you know how to shoot a gun. You know that you have to do it in between heart rates, but it's not only her heart rate, but the fetal heart rate and the elbows that she was getting every once in a while. So she'd talk to the baby and calm it down between the shots. So that was kind of cool. And you've probably heard of Amber Miller, or if you haven't, this woman had permission from her physician to walk the first half of the Chicago Marathon. Well, Amber, who had run through other pregnancies, or first pregnancy, was feeling great at 13 miles. So she kind of walked and jogged along the way and finished the thing. Then she went out and got something to eat. And then she started feeling contractions, went to the hospital and delivered. So that's a pretty full day for Amber. So this got the point is her physician probably knew she was going to do this. And it was one of those, and the crews, the medical team for the Chicago Marathon kind of had her on alert there. So they knew what was going on. Now this is the most recent one I've gotten some information on, the Crossfitting Mama, and when this first came out, it was a lot of hullabaloo, and people had opinions on all sides. And the thing that I didn't see in the first study, the most important thing I would ever look at is what did her physician say? And later on, she says, the physician said fine. And also, even though this middle picture looks impressive to me, what was this compared to what she used to do? And she said she backed off about 50%. Well, she reduced it. So maybe for Leanne, that's fine. Now, again, this is not a recommendation for everybody, but there are some out there that can do that. But the important thing is this. You have to have the relationship with the healthcare provider, all the way, psychological, physical, everything else, and you've got to build this trust. And that's what I would tell any woman who's a high-level athlete. Obviously, the blunt trauma you don't want to do. You're worried about balance, and obviously hydration that Roberta talked about earlier, and heat. There are warning signs that hopefully every woman learns about when she's at her physician's office, and you don't ignore them. So how much is okay? You really can't generalize. Everyone must be individualized, and don't ignore the symptoms. Now, just to switch off just a little bit, talking about gestational weight gain, the Institute of Medicine has told women how much they should gain based on their pre-pregnancy weight, and I'm just going to summarize the studies that have been done that have looked at this. And it's not a huge difference, but it's a little bit in terms of the weight gain. And typically it happens if they also take care of their diet. So the two go hand in hand, which shouldn't be a surprise to most of you out there. Now, what are some barriers? Well, this woman was kind of complaining, the road construction crew, because they were jackhammering, and she thought that was going to hurt her baby. You can see her standing there with a cigarette in her mouth. So, I don't know. I don't know if that's a barrier. There's a lot of barriers. There's the normal ones that we have just to get everybody off the couch. And when you overlay pregnancy, it gets difficult because they have a relative who said, no, you shouldn't do that. There are cultural differences. So it's very, very difficult. And this is an exciting area that we're starting to look at now to find out what we can do to get over that barrier. And you have to work with the family, with the support system, and certainly with the medical staff. Well, what about after pregnancy? When can a woman resume? Well, there's a good answer. It depends. How much did she do during pregnancy? How difficult was the delivery? And this is what ACOG says. I know a lawyer wrote this. I mean, this is the biggest statement that sounds impressive that really doesn't say anything, which is fine. If I had their malpractice insurance, I'd say the same thing. You know, it's interesting. The studies that have looked at barriers with very, very active women and looked at barriers with women who are more sedentary, the barriers are pretty much the same. It's just that the active women figure out a way to get around it. And sometimes it's an SES education factor, and sometimes it's just the fact that they're athletes and they've always had to overcome barriers. You've probably heard about Dara Torres. She did very well after the Olympics. Paula Radcliffe. Now, I was interviewed by the New York Times about Paula Radcliffe, and I made a statement like, very impressive that she could do this. Not many women could do it. The New York Times said, Dr. Pivarnik says, no woman's ever done that. And I thought, uh-oh. The next morning, I was at ACSM headquarters at 7 a.m. in the morning. The paper had just come out. I got an email. This is great. I'm a marathoner myself who's run through 4 pregnancies, resumed running 2 days after giving birth, also ran the LA Marathon 4 weeks postpartum for my fastest time ever. What do you know? So you know what I did? I emailed her back and we had some great conversations. So that's not what I said. It's rare. There aren't too many women like this, but it is possible for the high-level ones. And just one last thing. What can we do now about the women and to keep them active during pregnancy and afterwards? Well, one of my students has a paper coming out in the American Journal of Lifestyle Medicine. And we did find that the self-efficacy for activity, how well the woman thinks that she can be active and successful, it's really related to how long she'll stay physically active during pregnancy and also pick it up again postpartum. And the exciting thing with these women is it was inversely related to weight retention, which is fantastic. So I think as healthcare providers and those who are going to work with these women, if we can get this education to them, then I think we'll go a long way. So I want to do a shout out to my Michigan State friends, and thank you. Thanks.
Good job, Jim.
Thanks.
So we got some questions for you here, if I can get my screen to turn up here. Melissa B. Howdy. How has exercise during pregnancy helped reduce the rates of gestational diabetes?
Yes.
Okay.
And the thing about that is, like a lot of diabetes, diabetes is very responsive to physical activity. You don't have to be doing lots of interval training and crossfitting and stuff to do it. It's the same thing with pregnancy. So even a walking program will help, yes.
Great. From Cal L, is there any type of movement or exercise like sit-ups that pregnant women should avoid?
It depends on the woman. I wouldn't say start the World Sit-Up Championship contest because there's the fear of the rectus diastasis where the muscles are sort of separating. If you have that problem, obviously stop. One of the things that I usually tell women is do the, rather than inverted sit-ups, go the other way. So you're sitting down, so to speak. And that seems to work.
Okay. Sandy K. from TAMU class of 94. Are there new recommendations for very active women carrying multiples?
Very active women carrying multiples. That would be a very thin slice of the world's population. The problem is with guidelines is you can't write guidelines for every little group. Yeah. If the question is multiples, I would say go to your healthcare provider. They're the best source, regardless of activity.
Follow your physician instructions.
For sure.
And the last one, from Sophie G. At UNC Charlotte. Does exercise during pregnancy alter the nutrient needs of the mother?
Yeah, it does a little bit, but again, it depends on how much she's doing. So if she exercises a lot, yes. But it's really no different. She wants to have a steady weight gain, assuming her physician wants her to. So take this into account, work with a dietitian that works with the prenatal clinic, and you should be fine.
Super. Jim, thank you so much.
Thank you.
Great having you.
Thank you.